Hello, my name is Christian Brimberry. I am currently the Center Supervisor for Crockett Head Start. Before that, I was a teacher for Head Start for about 13 years. Before that, I was an aide for an ISD in the self-contained classroom for 5 years. So let's say that I have been educating young minds for about 18 years. In the ISD, this is where I met, let's just call him Joseph. Joseph's mom said that he was a happy, healthy little boy. Then, when he was about 2.5, he stopped talking, stopped making eye contact, and he became very aggressive over the smallest things, such as him being hungry, wanting a toy, or just was aggravated with something, but couldn't speak to let her know what it was. She took him to the doctor and learned that Joseph had autism. Did you know that autism can be detected as early as 18 months, and by the age 2, a reliable diagnosis can be given? CDC 2019. Autism is also called autism spectrum disorder, or ASD. The reason being is because there are different spectrum function levels. ASD is a neurological development disability that people have to live with for the rest of their lives. Magdalena and Associates, 2020. There are three main functioning levels. The levels allow clear placement on diagnosis. Gilmore, 2019. ASD ranges from mild to severe symptoms. Level 1 requires some support entering into social interactions. Level 2 requires more support because of the limited interest in social interactions. And level 3 requires the most support and is the severe level. Joseph was on that third level. He was nonverbal, he did not interact with any of the other children, and became very aggressive at times. The risk factors of children with ASD is still poorly understood. According to Overall 2021 article, research has found that the link to certain risk might put families at a higher risk of their child developing ASD. Risk factors such as genetic disorder, being born to older parents, low birth rate, and mother's medical history of viral infections. May and Associates 2020 state that early intervention helps language, cognitive, and social development. Interventions that Joseph had was applied behavior, where it encouraged positive behavior. He had a PEG system board where he would pull pictures of what he wanted and put them on a already made sentence strip. We would read what he said and respond to his request. A speech therapist would come in and work with him to learn new words and sentences. He also had an occupational therapist who came in and worked with him to help him with his self-help skills. Having an Associates 2020 states that parents can be hesitant to accept that their child has ASD due to others saying that it's because they have bad genetic genes. Joseph's mom stated that the immunization shots is the reason that Joseph developed autism. Others blame it on the food being the way it's being processed and mothers having bad or poor diets, or that God is punishing the parent so their child has ASD. Memory and Associates 2017 says that many parents use gestures to communicate with their children who have ASD. For Joseph, we used a little bit of baby sign language, but for the most part we used the PEC system, or picture exchange communication. He eventually grew from the communication board, where he took the pictures and put them onto a sentence strip and we read to him what it said and then responded, to an electronic communication board where all he had to do was touch the picture and it would read to us what he wanted. In Sager and Associates 2019 article, it states that parents need to know that their child's needs and education should be met by the school, and that their child is attending to. Needs such as communication, social skills, learning, sensory, and behavior. Parents need to be included into the information that is going on at school so that they can continue the work at home. This way, it is a joint effort to making sure that the child is having a steady continuance of their learning from home to school to school to home. There is no cure for ASD, but children with ASD can still have a full life. Early intervention is key to helping the child to be able to have that full life. Do research, ask questions from doctors, teachers, therapists, and parents who have children with ASD. Know your right as a parent and know your right for your child. A parent who is knowledgeable is a great tool for a child with ASD. Here are my references if you would like to take a look at them and check them out. Thank you for your time.